Thank you very much. Good evening, everyone. Are you able to see me and hear me? Okay, great. So as I'm speaking today, please don't be afraid to mute your mics and interact with me. It's kind of hard to stand up here and speak to yourself for so long. So I would just like to, before I continue, I'd like to say thank you to the Dean, the Program Coordinator, Ms. Rose, Ms. Mack, the Faculty Rep, and the Association President, Mr. Patterson, for having me here today. So S.M.R.T reached out to me and he asked me to come and do a short presentation to you guys for the pinning ceremony. But before I continue, I'd just like to pause and we say a quick prayer before we go into it. Let us pray. Heavenly Father, Lord, as we are about to go into this presentation, I pray that you will be with all those students who are about to be inducted. I pray that you'll bind them together and help them to realize that this journey will not be easy, but through you all things are possible. Bless us all in your name, I pray. Amen. Thank you so much for that warm introduction a while ago. Yes, I was known by some persons as Johnny Bravo. I don't have that here anymore. Some person said that's a good thing. I don't know about that. I'd like to begin with a quote. So the quote is, "Unity is strength. When there is teamwork and collaboration, wonderful things can be achieved." Now, as an association, the A.S.R is pretty new. Prior to this, we're just known as the student body, the radiography student body. So as an association, it's relatively new, but that doesn't take anything from how important and how impactful it can be. As members of this association, it's very important for you guys to realize how critical your job is or will be when you become radiographers. So I currently work at the Spanish Town Hospital, and some of the things that actually almost everything that I learned being a part of the A.S.R has become very vital to who I am today as a radiographer. Now, you might wonder, where am I going with this? You see that level of teamwork and that level of camaraderie that is required for you to be successful as an association that transfers over into the workplace. You might find it difficult working with some persons. We know that persons have different personalities, persons have varying ways of doing things. All of this is just a precursor to what it's like in the working world. When you come to work every day, there are going to be persons who don't fit your style of work, who have very strong opposing personalities to yours. There are going to be persons who might not like you. But all of this is just helping to prepare you for what you're going to have to deal with. So as young radiographers, you need to take the time to develop and learn this level of teamwork so that you may be able to be successful in the working world. You don't have to like anyone. You don't have to like everyone, but you need to be able to work with them in a professional manner. So being a part of A.S.R, it taught me quite a few things. One of them was how vital radiography is. Now, let me just throw out a question out there. How many of us have friends who are in the medical faculty who aren't radiographers? This is where I want you guys to participate. All right, great. I see hands going up. I'm sure that prior to you, or maybe a few years ago, a lot of them did not know what radiography is. And this is a problem all across. Up to now, even when I am at work, person asks me, what am I? I said, I'm the radiographer. They're like, what is that? Is that different from radiologists? And I have to say yes, and take the time to explain to them. Something that I've realized is that a lot of radiographers don't take pride in their profession. Now, at this stage where you are, I want you to just take a moment and appreciate how vital your job is going to be in the whole diagnosis of a patient. Your job is extremely vital. A lot of these doctors, sad to say, won't be able to do their jobs effectively without you. Yes, I know that there are many of us who, not us, well, many of you who radiography might not have been your first choice. When I was in first year and they went around the room and asked how many of us was radiography your first choice, it was like 3 of us in a class of 20 or 30. And that says a lot, because a lot of you are now in places where you might not have planned to be 5 years ago. In fact, some of you might not even had known about radiography 5 years ago. But now that you are here, I want you to appreciate it, learn to love it, because it is very interesting. There are so many things out there that you see. There are so many cases, especially if you decide to work in a public place. So let me just give you some examples. My friends recently started to call me the quote-unquote celebrity radiographer, because there was a point where everything that came on the news, that patient had to pass through the radiography department at the hospital where I'm at Spanish Town. So everything that happened in St. Catherine or in Portmore, those patients were passing through us. So you just had to prepare yourself when you saw something on, I don't know how many of you guys follow Dear Dream or This Is a Blast. Whenever you see something on This Is a Blast and you look at the location, you say, okay, you're gonna get that patient soon enough. And you just gear up yourself, prepare yourself. And it can be very exciting at times. It's not a boring profession. It's something that you love. If you actually engage in it, you learn to love it so much. There are times when you get called, maybe if you're working night duty, you get called 3 o'clock in the morning. Somebody crashed off their bike outside, and you see some ridiculous things that you weren't even thinking about. You see, I don't know if I'm morbid, but I love to see patients where the limbs gone or things like that, because it adds that sort of excitement. Yes, you want to see them get better, but you're the first person to see what's actually wrong with them. And that is something that you should not take for granted. And this draws me to something that I know Miss Rose and Miss McIntosh feel very strongly about, and that's your patient care. When you're dealing with your patients, it's very important that you feel a strong level of empathy towards them, right? You are going into a profession where you see people at their lowest. These are persons who maybe a couple minutes ago, they were walking on the road perfectly fine. All of a sudden, they're hit down, they end up on your X-ray table. You are one of the first faces that they see. Maybe if they were unconscious, they're up, they see the doctors, and then they see you. You need to learn how to deal with this patient with compassion. You need to learn how to deal with this patient with love. And yes, you want to do everything to get your images right? So you don't want to sacrifice your patient care for your positioning, but you need to find a way to have the right balance between that. So coming up in the A.S.R, there were quite a few events that we had. So I don't know, do we still have the Give It initiative, Shamar?
Yes, we do. We're actually going to carry it out next month.
Okay, great. So the Give It initiative, back in my year, it helped us to realize how persons have it, how fortunate we are, right? There are persons out there who they really need it. And sometimes we find ourselves in sort of a bubble where you associate with persons who are similar social status with you. Everybody's coming to school, everybody's wearing clothes, and we tend to forget how disadvantaged some persons in the world really are. When you begin to work, maybe not if you're working in a private place, but if you decide to work public, you are going to come across persons of varying social statuses. You might end up get a madman from off the road. You might end up get a politician. So you, as young radiographers, you need to learn how to address and deal with them. So just because you see a man rugged out there doesn't mean that looking rugged and maybe in torn up clothes doesn't mean that you're going to want to talk down to them. You need to find that level of professionalism, but also that level of compassion that you can address everybody with respect and treat them with respect, no matter what they did and no matter who they are. And there are going to be times when your patients test you. The amount of times I've had patients tell me about my parts, tell me all sorts of foul words. There are gonna come times when it can get very stressful. So at this level, take time to learn to have that patience, to have that compassion, to have that empathy towards them, because a lot of them, they just end up acting out because of frustration, because maybe they were at the hospital whole day. A lot of things they might have been dealing with, and they end up lashing out at you. So you need to be prepared to deal with all of that. It might be asking a lot from you, and it might take a mental toll if you allow it to. But you see, if you just take a step back and put yourself in their position, put yourself in their shoes, you might find that you are more understanding to whatever plight or situation that they're in. And you realize that whatever they lashed out on you, whatever reason that was, it might have just been some form of a coping mechanism. So I want you to participate in the Give It initiative. Take the time out. I know that the schedule can be very busy. Trust me, I know. Sometimes we're doing 12 courses. Sometimes you have this group work, and by the time you have this group work, you have a mid-semester, then you have the mid-semester rollover into the final exams, and you're doing mid-semesters at the same time that you're doing final exams, and you have this due and that due, and everything just is rolling behind each other. And we don't want you to fall back on your grades, right? But others out there who are disadvantaged, you need to learn to appreciate and love them, because if you can give back to that person and help them, you really should. In this line of work, you're almost a caregiver. You might not be directly giving them care, so you might not be a nurse, or you might not be a doctor, but when they are in your x-ray room, you have to exhibit some form of care when you are dealing with them. So you're positioning them, the person might be having pain. You can't just drag them hand and push it down to get your hand x-ray. You need to find how to be caring towards patients like that. And I think something like the Give It initiative really should have a lot of support, because persons out there really need our help. Another thing is, I need you to take a lot of pride in your profession. I might have hinted at it earlier, but there are radiographers who finish school, finish S.M.R.T, and they still don't appreciate how important radiography is. If it's not for you, that is understandable, right? But know that you are here, you need to take pride in what you are doing and do it extremely well, right? When an image comes up, because there are going to be times when sometimes an image is sent off and it's brought back for review. You need to be able to look at that image and say, that is not my work. Why? Because you take so much pride in your work that you know that you will never send off an image like this, because it's very vital for the patient's diagnosis. Maybe you are doing a patient that is giving you some sort of problems and you just want to rush them and get out of the room. Don't do that. Yes, rush them, but still do your work properly, because maybe you angle the beam and you end up with something foreshortened or something magnified that you don't need magnified, and that can end up affecting the diagnosis. And we don't want that, because at the end of the day, that patient is going to be at a disadvantage because of you. And I don't want that on my conscience, and I sure you don't. Because at the end of the day, this could be your relative, this could be your family member. It sure is somebody's. So you need to have that love for that patient, that you can put yourself in their position almost. And because of that, you do your work so well that you can be proud of it at the end of the day. So as I wrap up, I just want you guys, as young and upcoming radiographers, to take a moment, sit back, appreciate where you are, right? For those of you who are in first year, you've made it. And even though you've made it, you still have a long way to go. For those of you who are in final year, you're almost there. And given that you're almost there, keep pushing. I know that it gets hard. Miss Rose talked about planning and perseverance. Perseverance is very important as a radiography student. There are going to be times when everything feels like it's piling up on you and the whole world is coming down. You're not getting enough sleep. Some of you might not be eating. You're doing all-nighters and maybe the work is still not sticking. Keep pushing. Don't be afraid to also come to members of the faculty and ask for help. We are blessed in radiography to have very good lecturers. When I told persons that I could go and ask my lecturers for help if there was something I don't understand, I could go and ask them, they didn't believe me because not all lecturers are as approachable. So in S.M.R.T, this is a blessing. Utilize it. But no say, you might feel like you're bother Miss Rose or you're bother Miss McIntosh. Don't feel that way. They love you guys and they want the best for you guys. So go to them. Maybe if they're busy, find a one-off time where you can go back and ask for some help. But utilize all the resources that are available to you. Because without a plan, if you fail to plan, you plan to fail. You don't want that to happen. So I'll leave this with you guys, that teamwork is vital. So the grades them now run way. It is very possible for every single person in your class to get an A. So just work with each other. The association is very vital. It's your form of representation on the faculty, right? So your student body is what shows you. So when you guys are going out to maybe orientation, or I don't remember the name of that thing that they normally have where you have the different tents and they showcase those things and you go and you speak about your club. That is where you go and you make people know that radiography is here. We are this and we don't plan to go anywhere. We are proud of what we are doing and we will continue doing it. So come together, work with each other, appreciate where you are, and no matter what, keep pushing because you're almost there. And even if you feel like there's still a long way to go, in no time, it's gonna be all over. Think about it. It's gonna be 3 years from now, in 3 years from now, regardless. So would you want 3 years from now to come with your degree or without your degree? So keep pushing, and I hope each and every one of you make it together as a team. If you want to go fast, go by yourself. But if you want to go far, go together. Thank you.